In this video, we'll be discussing diabetes. We will talk about the difference between type 1 and type 2 diabetes. So let's begin. So let's start off by discussing what is diabetes. We all have heard of diabetes and aware of the high prevalence rate in the United States. It is one of the leading causes of adult blindness, end-stage renal disease, non-traumatic lower limb amputations, neuropathy, and infections. It is also a major contributing factor to heart disease and strokes. So we can see that diabetes has a major impact on various body systems. So it is super important to understand what it is and how it affects the body. Diabetes is known to be a chronic health condition that affects the ability to turn food into energy. So now, when we eat, the food is broken down to glucose, which is the same as sugar. It is then released into our bloodstream. However, when the blood sugar in our bloodstream increases, the pancreas will be signaled to release insulin. Insulin is a hormone that is produced by the beta cells of the pancreas. Now, under normal conditions, insulin is continuously released into the bloodstream in small increments, and it's going to be increased at higher amounts when food is ingested. Insulin is going to lower the blood sugar and facilitate a stable normal glucose range, which is approximately 70 to 110. Now, insulin plays a key component in our bodies because it promotes that glucose transport from the bloodstream across the cell membrane and into the actual cell. Now, a way we can simplify that is think about glucose needing a car, and that car is going to be insulin. That insulin is going to drive it out of the bloodstream. However, those that are diabetic either do not produce enough insulin or can't use the insulin they actually make, or have absolutely no insulin at all. There are two types of diabetes, type 1 and type 2 diabetes. Type 1 diabetes has absolutely no insulin production from the pancreas. So think type 1, we have not even one. This is caused due to possible autoimmune response, viral infection, or even genetics. This, a lot of times, is going to be diagnosed during childhood. A lot of people are just going to live with it throughout their life. So pretty much the pancreas has complete destruction of those beta cells and has absolutely no insulin that's being secreted. Now, due to the insulin deficiency, it's going to lead into hyperglycemia and cell starvation. The cells can go into starvation mode and start breaking down the body's fat and protein into energy. Now that can cause ketones to build up and lead the patient into acidosis, which is very, very dangerous. Type 2 diabetes is when the pancreas does not produce enough insulin or produces bad insulin that is not working properly, which causes that insulin resistance. Now, this is usually diagnosed more in adulthood, and it is the most prevalent type of diabetes. There are many risk factors such as obesity, inactivity, advanced age, and family history. The onset of type 1 diabetes is going to be abrupt, versus type 2 diabetes is going to be gradual and over time. In order to be diagnosed with diabetes, there is a lab diagnostic test called the HbA1c, which measures the hemoglobin that is glycosylated that reflects the glucose level over the past 2 to 3 months. This test is used to diagnose, monitor the response to therapy, and screen patients with prediabetes. Now, anything greater than 6.5% is considered diabetic. Signs and symptoms of diabetes include the 3 Ps: polyuria, which is excessive peeing, polydipsia, which is excessive thirst, and polyphagia, which is excessive hunger. They can also have fatigue, drowsiness, dehydration, vision changes, prolonged wound healing, and recurrent infections, specifically a lot of yeast infections. The treatment for type 1 diabetes only has one treatment, and that is going to be the administration of insulin. Medications that are in the drug classification of oral hypoglycemics unfortunately do not work for these patients because they cannot make any insulin from their pancreas. They are going to need an exogenous insulin, which is from an actual outside source. So we will have to draw up insulin and actually give them insulin. Type 2 diabetes have two different types of treatment. One is going to be simply to change up their diet, incorporate an exercise plan, and second is going to be taking medications, which are going to be oral hypoglycemics such as glipizide and metformin. If you found this video helpful, don't forget to like and subscribe here below. Also, don't forget to check out my video about acute pancreatitis shown here above. This will help you understand various diseases that happen in the pancreas. Also, if you find anything that you would want more lectures on or tips on going through nursing school, please leave them in the comments below. See y'all next time.